So one might ask me, how is my school different? Well, first I want to say that every osteopath works differently. And I want to use that as a frame of reference for how I'm going to answer this question. So what I envisage in this school is a school of good, solid health science knowledge, an in-depth knowledge of anatomy, an understanding of physiology, a solid grounding in neurology. Those are all the fundamentals that I have in mind. And I want the student who finishes with my program to have a complete command of those topics such that they can be fluid, moving between topic, moving between discipline, merging all those ideas that they might have about what is going on together, or what choice of intervention to utilize with the system to really be in a place of best interest for their patient. One of the areas that we draw upon heavily in our school is the complexity philosophy. And so when I say complexity, what I mean is we're looking at different areas of science, we're looking at concepts of philosophy, we're looking at the interaction between people, we're looking at the interaction between systems, and we're respecting that and understanding that all of that is involved in something like a treatment. So when I say health, what I mean is the sum total of how that person exists in their world. And how do I involve myself in that process for that limited amount of time that I see them, but give them something they can take away so that they can have a better or more sustainable level of health in their whole life. This program that I'm offering is non-formulaic. I'm not creating students who are going to be carbon copies of me at my practice. I'm training individuals to be great therapists in their own way. So formulas, out the window. This is about teaching people to be strong as individuals and have a commanding knowledge that they can draw upon. What it would take for someone to follow this program is commitment, determination, intelligence, and fortitude. And what they will understand, as I envisage it, is that they are independent and strong and competent, and they're going to make a decent living. And like I do in my practice, every day I'm working with something different. I'm working with a different person. I'm working with different systems. It's constantly variety. I'm never bored. My own concern is that sometimes I get impatient. But aside from that, this is a wonderful practice and a wonderful profession. Within the general context of the school, there will be several smaller programs that people can take a la carte, if you like. So what I mean by that is if someone's already got an osteopathic diploma, or if they've been trained in another profession, they can follow these programs separately. And so one of the programs, for example, would be osteopathic movement therapy. And that would consist of 5 or 6 classes that are part of the program already. Another area that people could study independently would be functional neurology. So if someone has a doctorate, say, in chiropractic or naturopathy, they could follow those specific courses related to that program. And that would be something like 1 course a year for the first 3 years, and then 4 courses or 5 courses in the last 2 years. Another area that people would be interested in is in cranial work. So studying osteopathic cranial work as taught in the school. Again, that would be a certain group of lectures, 1 in the first year, 2 in the second year, and 2 each year for the remaining years, totaling about 7 to 8 classes altogether.